Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Health Equity Teachers Module, Creating Health Equity for Hispanic Populations. The objective for this module is that by the end, learners will be able to identify a medical provider's role to create health equity for Hispanic populations, including actions they can take from both an interpersonal and structural level. So to begin, we have to define health equity. And in one of the papers in our learning material beautifully describes this. A cohesive culture with health equity is one in which everyone works both individually and as a group to ensure that each individual has fair and just opportunity for health and wealth, as well as equitable access to basic services and resources required for these goals. And so this module is about doing just that for our Hispanic population and Hispanic patients that we see. In order to do that, we have to first understand what is making Hispanic health so inequitable in the United States. One of those things is implicit and explicit bias. We'll go on to define this in a little bit, but implicit and explicit bias impact patient-provider relationship as well as patient treatment decisions and health outcomes, leading to health inequity for Hispanics in the United States. Another factor creating Hispanic health inequity in the United States is structural racism. And so this is racism and discrimination that exists within our country's systems, our society, our systems, our structures that make up our legal, health systems, education systems. All of our establishments contain racism and discrimination through their practices and policies that has been built throughout the years in the United States. And what this does is reinforces and perpetuates these dynamics that are advantageous to white populations and that meanwhile are creating adverse social determinants and outcomes for minority groups and people of color, including Hispanic populations. So first we need to understand these implicit and explicit biases, structural racism, these components that are creating Hispanic health inequity in order before we then go and dismantle and reduce health inequity for these populations. And the whole goal of this presentation is for medical providers to understand what they can do both personally on a patient level as well as on a structural level to create Hispanic health equity in the United States. The first thing that we need to do on a personal level and interpersonal level is recognize and reduce biases. So there's two types of bias that exist in this realm, and the first is explicit bias, and this is what we think of immediately when we think of stereotypes, prejudice, discrimination. It's that outward, consciously held set of beliefs about a social group, whether it be a random group, a minority, and these are ones that are out there and openly hold. And these are currently, they still exist. They're openly, like explicit bias is more openly rejected by society and by individuals as inappropriate. However, it does still persist within our society, and it's important to recognize and refute and combat within our own practices as well as the practices of our peers. Now, implicit bias is different because these are preconceived notions which affect our understanding, our actions, and our decisions about others, but they operate beyond our control. They operate unconsciously. And so these notions have been built and ingrained in us through our education, through our upbringing, through our country's systems and structures, and they operate unconsciously within our actions and our decisions. Now, in terms of equity, this leads us to behave in a certain way through our actions and decisions towards a person or group of people involuntarily and unintentionally, that perpetuates inequity. And this is huge within healthcare because as healthcare providers, our goal is to provide the golden standard of care for all of our patients, just without regard to their identities. We provide that standard for everyone, but implicit bias prevents us from doing that unconsciously. Now, these implicit biases, it's important to recognize that they might not and usually don't necessarily align with someone's explicit beliefs and biases. So you may not be aware of your implicit bias, and that's why it's important to do a lot of self-reflection and exercises that allow you to recognize your implicit biases that you have so that you can then combat them. Now, in terms of healthcare, it's been shown by several studies that implicit bias is present in healthcare. It affects patient-provider relationships, like I said. It has been shown to affect patient outcomes and patient treatment. The Institute of Medicine has published a report stating that bias, stereotyping, clinical uncertainty on the part of healthcare providers contributes to significant health disparities within the United States. The good news is that implicit bias has been shown to be malleable. And this means that we can unlearn our implicit biases that are harming our patients and replace them with new mental associations that will enable true health equity for all of our populations, including the Hispanic population. And in order to do that, in order to mitigate implicit bias, it is an active process. It is a long-term goal requiring constant attention and repetition through a combination of strategies. And so this means that it cannot be fixed overnight. You're not going to wake up and immediately be able to provide truly unbiased care for your patients. It's going to require time. It's going to be a continuous process, and one that you have to really work at. The first step is identifying your biases. This can be done through reflection, through conversations with others, and peer-to-peer mentoring. It can also be identified through things called implicit association tests, which one is included in this module for your own experience to try to identify, practice identifying your implicit biases. Once identified, implicit biases can then be combated. They can be combated through just personal effort and education. Education about your biases, how to combat them, and why combating them is important. And then active efforts based on that education through your own personal thoughts and actions. On a larger scale, you can get involved or implement intervention programs that are specifically aimed to rewire implicit biases to include more compassion and understanding for minorities. And so you can do this as an individual, you can do this as a healthcare practice, as a hospital, as any type of group. It can be done at any level, these programs that can help you actively combat your implicit bias. So, like I said, the first step to creating equitable care for our populations, including our Hispanic populations, is to recognize and reduce our biases that involve Hispanic populations. The next thing you can do as you're doing that, it's not a consecutive thing, but you're doing these things simultaneously, is practice patient-centered medicine. And what this means is, like you strive to do with all your patients, or should be striving to do with all your patients, is treating them, their needs, their wants, their values, their situations specifically. And that includes our care for Hispanic individuals and populations. As we know, every patient and their unique experience, every patient and their experience is unique. And as I discussed in the previous module, there are common trends within the Hispanic population in terms of social determinants of health disparities, and healthcare disparities. but every single patient is unique. So you need to get to know your patient through patient history taking, through your continued longitudinal relationship with them, get to know their background, their values, their lifestyle, in order to identify within them their social determinants of health, their health needs, what you can do to help them reach full health and have health equity. And so through identifying and getting to know your patient, you can then form your approach to care, preventative care, acute and chronic care, end of life care, as well as addressing social determinants of health. You can build that around your patient, their needs, their social determinants of health. And this is why I love this framework, this conceptual framework, is that several things go into a patient's health, and it really has to be built upon by the patient's specific experience and unique qualities. Their demography, their socioeconomic status, all their social determinants of health, their risk factors that they have, their current health state. Take each patient as their own and treat them equitably based on their needs. We've covered what you can do on a personal level, on a patient level, and you can't forget that we also need to work, especially as medical providers, on the structural level. We need to advocate for structural reform, remodeling, and justice for all of our populations, including our Hispanic populations. Now, the term systemic justification refers to the theory that people will rationalize the status quo based on their belief that the social, economic, and political systems must be fair and advantageous because they are in place. Now, this system justification is done by majority populations, by minority populations. Everyone does it, but we have to actively reject this idea of system justification and behavior of system justification in order to advocate for a better structure of our society, for our better systems that we run. We want to actively advocate for practices and policies that mitigate structural racism that's present, that promote cultural humility, that empower our minority populations in order to have equitable care, and create a more equitable society and healthcare system. So as human beings, but also as medical professionals, we have a responsibility to advocate for all of our patients, and that includes for advocating for better systems that allow for better health and lifestyles for those patients. That concludes our module on creating equitable care for Hispanic populations. I know it was more brief and summarized in terms of things you can do, but know that taking these actions towards equitable care, both on the personal, patient, and advocacy levels, will require serious effort, conscious, active effort to make them happen. So I encourage everyone to go out there and make a change. Thank you.